Thank you for coming and welcome to our webinar, Mental Health Regulations, Metrics and Building Sustainable High Performance. On behalf of the speaking team and the World Federation of Mental Health, I'm delighted to welcome you to today and to thank you for making time for an important conversation about an issue that's becoming increasingly urgent in our world. As we start and as you arrive, we would love to see in the chat where you're coming in from. And also, if you could just take a moment to share with us an acknowledgement of country. So I'd like to begin by acknowledging the traditional custodians of the land from which I am joining you today, the Camaragal people of the Eora Nation here in Mosman, Sydney. I pay my respects to their elders, past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Island peoples. As we gather today from many places around the world, synchronously and asynchronously, I also acknowledge the traditional custodians of the lands wherever you're coming from and recognise their continuing connection to land, water and culture. So please continue to pop into the chat where you're coming from. We'd love to know. We'd also love to know in the chat what's on your mind about this topic today. And as we go through our time together, the speakers will do their best to answer you, if not during our session afterwards. For those of you who don't know me, I'm Dr. Elizabeth King. I'm a member of the board of the World Federation of Mental Health and I chair the Workplace Committee. This particular webinar has been brought to you, sponsored by the Workplace Committee and also the Global Program Committee, who's recognising the role that Australia has made in showing us one approach to using regulations. For those of you who are less familiar with the World Federation, we're a global non-government organisation founded in 1948. And the Federation is dedicated to advancing mental health awareness, prevention and advocacy, and to promote best practice worldwide. One of the reasons that I was so interested in joining the Federation was a comment from a past president that is mental health challenges are not primarily medical issues, and neither are their solutions, which sets the scene for why the workplace is such an important aspect of the discussion about mental health. And I'll just share with you now a slide that reminds us that the evidence is clear for the urgency of this topic. 1 in 4 people globally are affected by mental health disorders. Most of us will have either had that touch our life in our way, either personally or professionally. And we do know the incredible impact that has on the way society functions. COVID taught us all that biological challenges, health challenges, are not isolated to the individuals experiencing, and mental health is the same. So today our aim is to move from awareness to taking action, from policy to practice, so that we can create some real sustainable change in this topic area. To set us up for our day, I'd like to share that we are looking at really 3 tensions. We're not suggesting that we have all the solutions, but we wanted to frame it that there's 3 tensions where this particular webinar is addressing. The first tension is from measurement to meaning, and that it's acknowledging that data gives us clarity and accountability, but not everything that matters can be measured, and not everything that measures matters. So it's important to have a very insightful measurement system. The second tension that we're acknowledging is this distinction between protection and empowerment, and that regulations are crucial for safety and for clarity, but over-regulation will stifle and potentially stop the part of the work that's really about leadership behaviour. And third, we're looking at the narrative tension between performance and well-being, acknowledging that these are not trade-offs. Acknowledging that, in fact, when we support people's well-being, we are increasing performance. Change occurs in 4 steps in any way: clarity on the reality of the situation, a strong vision for what is preferred, some steps to move from reality to vision and some continued measurement of action. What we're doing today is offering you an agenda that outlines that type of process. I'm honoured to introduce to you Mr. Mark Wright, who will be our first speaker, Mr. Jim Kelly, our second speaker, and Mr. Mark Butler, our third speaker. Mark Wright is a health and safety expert. He's got a consulting business that helps us measure meaningful metrics. And his message to us today is around the fact that data without solutions is really just interesting. Mark will talk to you more about that. Mr. Jim Kelly has a deep expertise in health and safety regulation, prevention and rehabilitation. Jim has led Australia's first code of practice for managing psychosocial hazards. He now heads up people care at icare, and he's bringing to us a message around the fact that successful businesses are safe businesses, that successful leaders value and respect people. And Mr. Mark Butler shows us the way we move from our problem to our solution with the encouraging side effect that working on developing strong regulation practices actually delivers strong performance outcomes. From that point, I'm delighted to introduce to you Mr. Mark Wright, who will help us understand how to measure what's meaningful.
You're muted, Mark, I think.
Mark, we can't hear you. Mario, could you unmute Mark for us?
There he is.
Oh.
Thank you, Liz. Can you hear me now?
Yeah.
Great. Yes, I unmuted myself, but there was an override, so it's all fixed now. So thank you. So really look forward to sharing some learning today. Liz mentioned the importance of metrics, and before we get lost in data, it's worth acknowledging this is about people and having a genuine care and concern for people. Today, I'll be working through the outcomes and learning from a statistically reliable climate survey, and along those lines, we'll be sharing some insights and learning that we can hopefully provide people on the call today that they can take away and potentially think a little bit more around what they can do more differently in their organisations. So to do that, I'll start off with some of the challenges that we face, not only in Australia, but globally. Liz has touched on some of those statistics already. What I will say, though, is that the costs, both the financial costs and the indirect costs on people, productivity, and the globe is absolutely tragic when we have a look at some of the numbers. I'll share some of the benchmark results, and then we'll go through some of those lessons learned. If we just look at the US alone, you can see some of the suicide rates, and the graph here, which is presented from the Bureau of Statistics in the US, is really tragic when you think about the loss of life through suicide, and that the numbers are not going down. If anything, they're getting worse. More broadly, globally, the World Health Organization has suggested that over $1 trillion is lost through workplace psychological illness, and that over 12 billion days of work is lost too because of illness. So there's a clear challenge that we face, and today I'd like to think that collectively we can share some information to help those listening today. So the overarching message here is that data without solutions is just interesting, but solutions without reliable data is also just a guess. So how do we use meaningful metrics to diagnose and come up with some solutions that's specific to organisational, team, and to some extent individual needs within organisations? What I'm presenting here today is a really simple summary of some of the data that we've got, some benchmark data from thousands and thousands of respondents from a psychosocial DX climate survey. And without going into the mechanics of the survey itself, what I'm presenting here today is some data. On the left-hand side here, you can see that of the 4 aspects that the survey uses to measure psychosocial performance, organisational factors are performing the worst, with the understanding that this is not always about tackling individual resilience or individual challenges. Often the systemic challenges we face with an organisation are systemic and organisational. So looking at things like job design, job demands, workload, all those things that impact more broadly across the organisation ultimately have an impact on individuals and teams. And we're seeing that through the data, that the way that organisations are acting and performing around the management of psychosocial factors is a real challenge. If we look at the dimensions as it relates to the psychosocial DX, cognitive and task demand is also performing the worst. So if we think about the speed of information, particularly with the introduction of AI and technology, the work demands often are getting faster, greater volume, and the speed of information is absolutely going from 0 to 100 overnight. And we're seeing that through the data. The demands on individuals around their ability to cope cognitively is becoming harder and harder. Without going through all of the detail around the dimensions, you can see there that there are a number of factors that impact psychosocial health in the workplace, and having a good understanding of the specific needs within your organisation can be really powerful. I get really excited around completing diagnostics within organisations because every survey result is different and every organisational need is different. So coming up with some sort of meaningful diagnostic to help your organisation can help with some really specific solutions. Often organisations will jump to solution mode before truly understanding the challenges. Throwing training at a problem which may be related to cognitive demand or relationship challenge with supervisors or teams is a band-aid solution, which isn't necessarily going to fix the underlying contributing factors that organisations face. As it relates to some of the outcomes presented through the psychosocial DX, it's worth recognising that the way that our surveys are designed, we've both got inputs and outputs. So by understanding the inputs around the conditions, their experiences, the practices that's happening in organisations, we can then relate those to what impact is that actually having on the organisation and the people within it. You can see here that as a result of some of those challenges that we've spoken about already, employee engagement and burnout is performing the worst. And unfortunately, that's also impacting on people's ability to sleep, to perform well mentally at work, and in some circumstances, having a higher intention to leave. By understanding the impact that some of the organisational practices, work conditions, and behaviours are having on individuals helps us better understand what solutions to come up with to support the organisation through their improvement journeys. If we have a look at some of the statistics on the slide here now, the other aspect of the psychosocial DX is a selection of about a dozen levers for action. So there's one thing to understand what's not working well or areas of focus. The other thing is to understand, well, what do we actually do? So the levers for action gives organisations an indication of where to start and the direction of where to act. The dozen levers you'll see on the screen here are a grouping of a whole bunch of statistically correlated metrics, which allows organisations to focus on things that are important to get the biggest return on investment. The numbers presented are based on an index from low through to high performance. And interestingly, Mark Butler today will be talking around what does it take to reach high performance with an organisation. This is not always about focusing on things that are not working. It's around how do we take the organisational journey and use these things to focus on high performance in a positive context as well. If we just have a brief look at the numbers there, we can see that change management is one of the poorest scoring results, all the way through to trust in leaders, which pleasingly is a better performing result. As we work with organisations and as you reflect what you need within your organisation, it's worth recognising that it's not always focusing on things that aren't working, but it's looking at things in a positive context, understanding what's working well, and leveraging those things that are working well to fix those things that require improvement. Based on our benchmark results, we often work with organisations to leverage things that are working, like trusted relationships with leaders, to improve things like change management, to improve accountability, work and job design, and to encourage praise and recognition to promote health, well-being and psychological health in the workplace. So you can see here, there are a range of different things that organisations can do. And the take-home message is trying to understand specifically what the needs are in your organisation by actively seeking feedback from your workforce to understand what's important to them. The last thing I'll speak about is some really basic principles around risk assessment. So Jim will talk about the regulations and the principles around risk a little bit more in a moment. What I'm referring to here is the use of data to inform a structured risk assessment process that allows organisations to focus on things that are important to them. So by actively seeking feedback from your workforce, particularly around psychosocial factors that are often invisible, you can quickly understand what hazards present within your organisation. Using both job demands and job resources and any sort of mismatch between those, we can quickly understand the impact or outcome that's having an effect on your workforce. So in effect, understanding both the likelihood and consequence of things that may impact on psychosocial health, and then informing risk. And as mentioned before, with any sort of good risk assessment process, there's often some sort of control or solution that's put in place to mitigate or reduce the risk with the view of trying to improve. So you can see very quickly the use of metrics can be used not only to understand what's working, areas of improvement, but also inform a structured risk assessment process to enable effective controls and improvement within your organisation. So with that said, I'll hand things over to Jim. I'll continue to manage the slides, and Jim will talk a little bit more around the regulations that underpin a lot of what we're talking about today.
Mark, just as we go to Jim, I wanted to thank you for that extraordinary examination of meaningful metrics, and just bring to Jim's attention a really important question that's come into the chat. I think Jim's got this really deep, he's seen regulation up close, and he can really help us talk about bridging, regulation to practical positive outcomes. And there's a chat question about over-regulation. And Jim, I just wanted to bring that into, voice that into our room. Thank you.
Yes, thanks, Liz and Mark. I really appreciate those insights, Mark, and the data and the really intuitive and insightful question Genevieve raised in relation to risks associated with introducing and managing regulations. For those that I don't know, I've been working with the New South Wales Work Health and Safety Regulator here in Australia for the last 17 years or so. New South Wales is one of 9 jurisdictions in Australia that manage work health and safety. We have a federated system where we do operate at a state and territory level in terms of legislation and regulation. However, we are working towards and doing our best to harmonise our legislation across the country, which has its challenges for all sorts of reasons. It's very challenging for organisations that work across borders within our country, and also very challenging for governments and regulators and those who are regulated in terms of being consistent across those borders in the state and territories. So I wanted to share a little bit with you about how we went about improving the regulatory framework for psychological health here in New South Wales, and how that has had a knock-on effect to other states and territories across Australia in terms of our harmonised model. So I'll touch on why we went about regulatory reform in this space, who benefits from the regulation, and things that we need to be considerate of when introducing regulations, particularly around those risk factors, as Genevieve has pointed out. How do we regulate mental health at work? So what was the approach that we took in terms of influencing the regulatory framework here in Australia? And also just touch on, obviously, the Australian experience and what's been the outcome of some of that work we've done over the last 10 years or so. It's really important to recognise that, obviously, we don't regulate unnecessarily. Generally, governments across the country and internationally really don't want to introduce regulations unnecessarily. There has to be a really good purpose and meaning for doing that, and we need to be really careful of the consequences of regulation. They can be very challenging, and I think, as Genevieve's pointed out, it has impacts on individuals and organisations and those who are regulated as well. So that's a really important consideration when embarking on any kind of regulatory practice. You may or may not be working with a regulator across your country around the world. However, you may want to either lobby for regulatory reform or changes, and some of these insights may be valuable in that regard. Thank you, Mark. So the framework on the slide at present is a fairly standard framework around the world, where legislation is prescribed in an act or in regulations, and they are essentially a law. They are the obligations that you must comply with. They are non-negotiable. They essentially set a base standard or a minimum standard of expectation when it comes to anything that is regulated through the use of legal material. Below that, you have the codes of practice and guidance material, and essentially, unless prescribed in the Act or the regulations, codes of practice and or guidance material, which may include things like standards, the international standard ISO 45003 is relevant in this space. They are not legislatively required. They are not law unless they are prescribed by the Act or the regulation themselves. However, they can be used as evidence by the regulators of what compliance looks like and what is expected of the Act or the regulation. And it's a really important distinction. You don't have to comply with the code or the guidance material unless it's prescribed in the regulations or the Act itself. However, the code of practice in particular can be used as evidence about what compliance looks like. And that's a really important distinction that we had to consider in the approach we took in terms of regulation. And it's quite standard and relevant across the world. Many countries around the world are really taking psychological health and safety very seriously now. From Australia's perspective, we've been watching very closely the French, and France have been quite progressed in this space since as far back as 2009. We've also been watching Canada, and the national standards and codes in Canada are quite progressed. And we've worked closely with the Canadian regulator in terms of some of the states in Canada, in terms of what they can do to learn from our experience here in Australia as well. And the Swedish have been very strong and influential in terms of international standards as well. So it's a fairly strong international movement in this space and very relevant to the conversation we're having here today. So why do we regulate? There's a range of questions that need to be considered both by government and regulators and the community more broadly speaking when considering regulations and reforms and changes to regulation. It includes what is the problem we're trying to fix. Regulation is there for a reason and a purpose, and we need to be really clear on what that purpose is. Generally speaking, there's a problem that we're trying to address. And in our case, we were seeing an increased number of mental health claims, psychological health claims for injury and illness relating to psychological health harm. We're seeing the cost and the impact of those claims, both on the economy and on the workers' compensation scheme that the government administers, but also on costs to business, the impact on employment, the impact on individuals, the impact on the healthcare system more broadly speaking. So there's a number of implications of rising causes of mental health. And we know the workplace is a significant contributing factor to that. Full-time workers spend a third of their time in the workplace environment. So the work can be a significant contributing factor, if not the cause of mental ill health. So therefore, we had a problem we needed to address, and we needed to raise the standard of how workplaces manage this risk in the workplace. The other thing we need to consider is really the public expectation. So is there a general community expectation that the workplace has some responsibility here, and does that need to be increased? So is there an appetite for change in space? Is the workplace community ready for regulatory reform? The other thing we need to consider is the community that we regulate, the regulated, ready for change, and are they on board with change? And that was a serious consideration for us as a regulator as we embarked on this process. Had they tackled the historical challenges of work health and safety in terms of physical harm and risk, and have we seen significant progression in that space? Where was their capability in terms of adapting and changing to psychological health? And also, does the regulator have the right authorising environment? So whether regulation comes from the top down, where government and ministers who are elected by the citizens drive regulatory reform, which is generally driven by the citizens and the mandate that they are elected to implement, or whether it's from a ground up, where the community expectations and the regulator put forward suggestions to the government to change. We need to consider whether the regulator is in a position and has the authorising environment, the ministers and the government of the day, to implement those changes. So for us in New South Wales, we've been watching and observing these changes in the mental health plans for some time. And it wasn't until 2018 where we had a minister who was actively engaged and personally passionate about mental health, where we saw an opportunity to really drive the changes that we needed to address this rising concern. And that was a really critical element to the change that we drove here in New South Wales. So moving on to who benefits from regulation. Generally speaking, the benefits of regulation should be for everyone, but it doesn't always happen that way. We might move to the next slide if we can, Mark. So essentially, the beneficiaries of regulations are normally those who are benefiting from the change in the laws that are being introduced. And in the workplace context, that's obviously workers who are at risk of injury or illness, or potentially fatalities in the serious work health and safety space. But it's also really important to consider other beneficiaries. And in our case, obviously we wanted to benefit the government and the scheme and the community from an economic perspective. A reduction in injury and illness will reduce the workers' compensation burden, which has all sorts of benefits financially for government and for those who pay premiums towards workers' compensation. So the economic benefits for business are quite substantial, and it's really important to measure and accurately reflect and communicate that. But it's also really important for businesses to recognise that increased regulation can have benefits in terms of a fair and equitable playing field. We often get concerns from employers who are complying with laws and regulations, who are arguing that others in the industry are not, and are cost cutting or taking steps to reduce the costs of that. So being aware of who are the beneficiaries and what is the benefits for all the different stakeholders is a really important part of selling the need for change or regulatory reform. And that was something we had to consider well before we embarked on the consultation phase of our regulatory changes in the psychological health and safety space. For us, work health and safety legislation always implied physical and psychological health in terms of the primary duties and obligations. However, what was lacking was clarity around what was expected when it came to psychological health. And the increased regulations that we introduced in terms of psychological health provided clarity around what was expected in terms of identifying, assessing, and controlling harms like psychological hazards and risks. One of the important elements we identified through consultation with employers and unions and the academics that we discussed this with was a real shift in distinction from a focus on the individual and the individual risk factors to a focus on the organisational risk factors and things that the organisation can control. Obviously, organisations have no influence or control over genetic factors or family factors that are outside the workplace. But what they do have control over is some of the things that Mark pointed out in his earlier slides around organisational risk factors, things like job demands, role clarity, interpersonal conflict in the workplace, violence and aggression, exposure to trauma or aggressive behaviour in the workplace. These are things that are very much in the workplace domain that the regulator and the employers can influence and control. And that was a really important focus in terms of where we put our attention. So how do we go about doing this? Moving on to the next slide. The approach we took is really being clear on that why and being able to communicate that to our community, our stakeholders across the board. So an economic analysis really assisted with that and really considering the economic benefits at all levels of our community, from individuals and workplaces, the cost of injury and illness, the cost to businesses and operating businesses, right through the economic benefits for government as well. That helped us influence each one of the stakeholders that we had to influence to drive this change. As I mentioned before, timing is really critical. We had a desire to do this sometime before we actually went down that path, and that was partly because the timing wasn't right. We wanted to provide advice and education and support businesses to implement change sooner than later, and we did that through an advisory approach. We also had to wait for the right government and ministers who had the interest and desire to tackle this challenge moving forward. We then also needed to manage the transition, so we had to do meaningful consultation with all the relevant stakeholders and support that by evidence-based literature and data to drive the change effectively as well. And as we approached implementation, we needed to make sure as a regulator we were prepared to roll out the changes that had to follow. So for us, that really needed to look at our compliance and enforcement mechanisms. There's no point in having regulatory laws and changes if they're not enforced, to make sure that standard, that minimum standard, is maintained and expected in order to drive the accountability measures that we're trying to drive. So moving on to the final slide I have there, really in Australia, we are committed to a harmonised model across the country, but that has all sorts of challenges politically in terms of influencing 9 jurisdictions across the country and driving the harmonised model that we work towards. So in New South Wales, we had a process we had to follow where we had to go to the national table first and propose changes in this area. When we did not receive the support we needed at the national table, we were then able to go alone here in New South Wales to develop. What we developed was essentially the code of practice first. So again, building on the primary duties and obligations for physical and psychological health, we provided clarity around what our expectations was through the code of practice. This enabled employers and others to contribute to the design and development of that code of practice and to prepare for increased regulation as our second phase. So in 2021, we introduced our code of practice, the first in our country and one of the most detailed around the world, which we can make available in the chat for your reference. And then we built on that in terms of the 2022 regulations, which were endorsed nationally as a harmonised regulatory change and rolled out state by state over a period of time. And you can see on the slide as the codes of practice and regulations slowly rolled out across the country since 2021 when we commenced that. You'll find in Australia is replicating what's happening around the world in terms of strengthening regulations to really raise the minimum standard of what employers and others in the workplace need to implement in order to make sure that work environment is as safe as possible, not just from a physical perspective, but from a psychological perspective. And that's it for me from a regulatory perspective, but happy to take calls, questions later on. Thank you.
Thanks, Jim. Does anybody want to voice a question at all as we move to Mark Butler? Also wanted to invite those of you who are not used to our Australian accents, if you'd like, you can use the captions button. But Mark has quite a different accent from a different part of the world, so it may or may not be easier for you.
Yeah, and good luck getting. Thank you very much, Liz, and good luck getting something to transcribe my accent a lot of the time. I'm going to share my slides in a slightly different way. I hope everybody can see that. So look, thank you, Liz, and thank you to Mark and Jim as well. I always learn something new whenever I'm in these good people's company. There was a couple of things that came up that Mark Wright mentioned as, the levers for action. He spoke about having trust in our leaders, and psychological safety in the workplace seems to have the greatest effect. And also that aligned in very nicely what Jim was saying about who benefits from the legislation and from the new regulations and the indeed very detailed code of practice. So I wanted to touch on this to some degree. To my mind, organizations that are chasing compliance, they're doing the right thing, yeah, for sure. But I sometimes wonder if the motivation is around compliance, or is it for something a little bit more than that? And I think there's a very happy outcome that in pursuit of the compliance with the regulations, we can actually achieve a sustainable higher level of performance in an organization. So essentially, to sum up, what the code of practice says in how we pursue compliance with the new regulations. Basically, what it's saying is there's some legislation or there's regulations here now. We need to have a policy that addresses those regulations, and we need to have a strategy that delivers on the policy, and then of course actionables that allow us to deliver on the strategy. So you can see there's a staged process that Jim pointed out. And there's a number of differences with this legislation that we've pursued here in Australia. And I mean, I won't get down into the difference between recklessness and negligence or evidentiary burden on proof, etc. Some of ours is quite different to other territories. But I will say this. It's basically about SafeWork. If there was a regulator or a prosecutor entered into your business, there's three things they really want to know. How do you know what the hazards your people are facing? How do you know what they are? What are you doing about mitigating or preventing those? And finally, how do the individuals in your workplace know? How do they report if they're experiencing a psychosocial hazard? So that's all about meeting the legislation. But in answering those questions, what we're actually doing is we're raising awareness within our teams. And you can see on the slide behind me, there's there is a four-step process about identifying the hazards in the organization. And you can see here the regulations determine that we need to consult everybody in the organization. And there's a reason for that I'll explain in just a minute. But once we've identified what the hazards everyone in the workplace are facing, we need to be able to assess the risk of those actually occurring. So we need to know how often they occur, how frequently they are, how long they last, and indeed how severe the actual challenges are. And then from there, we can control those outcomes. Preventing wherever possible, predicting, I think is really important, and mitigating when we need to do that as well. And then there's an ongoing process of reviewing and monitoring that situation. So that's the reason why we do it. There's also sort of from a macro perspective is why do we need to collaborate with everybody? And we use this Sydney Yoshida's model, which is based around risk in business, but it originally began as a sort of financial risk. But as a metaphor, it works very, very well for mental health in the workplace as well. And what we now know is that the psychosocial challenges or hazards are well known at the coalface or at the front line, where people either feel or will witness or observe distress in each other. And these challenges can become poorly known sort of the higher up we go in an organization. So what we do know is that of the psychosocial hazards that an organization can experience, the board or the C-suite sort of level get to know of about somewhere between 4 and 9% of the challenges that people in their organization face. When it comes to middle management, that is people who work as team leaders, supervisors, managers, those who work on a day-to-day basis with teams in the business as opposed to working on it, tend to experience or tend to find out about 50 to maybe 70% of the challenges that everyone in the organization faces. But there's a gap between what they experience or what they believe they know to exist in the workplace and how much actually is experienced. And there's a number of reasons as to why that might occur. First of all, people in an organization are under no obligation to declare when they're experiencing some kind of mental health distress, unless it renders them unable to do their work or they're a danger to themselves or others. So there's a number of criteria like that. But generally, people tend to not speak up if they don't feel it's safe to do so. Now, Mark Wright talked about psychological safety a little while ago and trusting in our leaders. And if people don't have that experience in the workplace of their leadership, they tend to not speak up for fear of being judged, harming their career. There can be cultural reasons as to why people remain quiet. And we know from experience that that is not beneficial to either them or to the organization. So there's a reason why we have to collaborate with everybody in an organization. We need to know what the psychosocial challenges everybody faces are. And very often, if that's conducted in the way of either health and safety representatives, sometimes focus groups, which aren't enough. Generally speaking, the most common method is to use a survey of some kind. And very often you'll find that that's the first time that people in the front line or sort of at the coal face, to use that vernacular, it's very often the first time anyone's actually asked them what is going on for them in their world. And we do know, as Dr. Elizabeth pointed out at the beginning, 1 in 4 people in any environment will experience a mental health challenge today. If they're not already, they will this year. And well over half of us will in our lifetime. So this is not sort of small information. It's not rare occurrences. This is actually happening all around us all the time. So that's the macro reason as to why we need to dive in and consult with everybody in the organization in order to meet the compliance. Here's what's actually happening for individuals. This research came from Jen Marr, who does a lot of work in the US in this space. And what she's discovered in their research is that 80% of us, including leaders here, 80% of us feel that we can see when somebody is experiencing some kind of distress or some sense of overwhelm, if you like. So 4 out of 5 of us reckon we can see it when it's happening. But somehow 80% of people who are experiencing distress feel unseen, feel like nobody notices them. And of those, 75% wish that they could be more open about their struggles. So we're back again to trusted leaders. We're back into this idea of psychological safety. And we also know from other research that 60% of leaders either can't, won't, or don't reach out to conduct these sorts of critical, caring conversations that we need to have with our people. So very often, the response is, you need to go see HR about that, or call the EAP service, or whatever it is. And these are no longer sufficient responses. In fact, I was just reading an article this morning that talks about the top uses of generative AI, which is rapidly becoming a whole other psychosocial hazard that we haven't considered before, is our fear of the advent of generative or agentic AI. And the number 1 use of AI last year was for generating ideas. This year, the number 1 use of generative AI is seen to be for therapy or companionship. Now that speaks really highly about our society and about how people are experiencing some level of loneliness or isolation, or they're needing some level of support. We're also noticing that people in team members are actually asking AI for solutions to problems in the workplace rather than asking their leader. So we've got a further disconnection and disengagement that we're starting to experience in workplaces, rendering leaders sometimes blind as to what's going on, and team members taking what they're being told verbatim and running with that. So you've got people in a team could be chasing a number of different sort of strategies and ways of working with the problems that they're experiencing. So, as Mark said, trust in our leaders is going to be probably one of the greatest levers that we can use for action. And to answer Jim's question of who benefits, well, the entire organization does when we have visibility over what's happening for our people. So there's a process then in achieving compliance, and there are organizations who have not yet embarked upon developing their strategy or policy around meeting the psychosocial needs and recognizing the hazards in their workplace. So they may be working below the line in what I'm showing here on my screen. And in fact, as we progress through the stages of compliance and meeting compliance, we become a bit more cognizant of what's happening for our people. We get better at recognizing challenges. And in doing so, we develop the skills and strategies and the policies and processes in order to achieve that level of compliance that we know we need to achieve. But there's a very happy outcome from all of that. There's something else that goes on when we're doing that, and that is leaders in any organization start to recognize this idea instead of being complacent and saying, go see HR or maybe ring the EAP service about that. There is a level of caution that they will experience in developing the skill sets and the emotional awareness and empathy required, that which is inbuilt in all of us, by the way, but what's required in order to deepen their leadership skills. And when they become more comfortable in having the conversations that previously they can't, won't, or don't have, then they develop a level of confidence in being able to have critical caring conversations with their people around their mental health. And if you want to talk about trust in leaders, that's where it's built. And when we develop a level of trust in our leaders, and our leaders become a bit more reliant, if you like, the reputation that they build as leaders stands to them very, very strongly. And what we notice when leaders' confidence and capability and comfortability in having the sorts of conversations and doing the work they need to support their teams themselves start to shift. They deepen engagement, they deepen cohesion, they start to become more trusting, not just of the leader, but of each other as well. And so the level of safety that we feel in the workplace, psychological and physical safety, grows. And with that grows that sense of trust in the leadership and each other. And when you've got safety and trust, you have a sense of belonging. Teams know that they matter. They know that they belong because the organization is asking them what can they do to support them in their well-being. And the final stage then the final stage to that is you'll find what happens with the culture in an organization. When you have an organization that checks in with its people because it cares, you have leaders whose responsibility and level of reliance grows with their confidence. Teams obviously feel like they belong, they feel like they matter, and they're seen and that they're heard, which deepens not just engagement, but it's also that leads to sustainable high performance. People want to belong to a team that's winning. And so the culture in an organization rises from what might be tense or troublesome or even toxic in some cases. We start turning the culture, first of all, in teams, because I think that's where it belongs. We start transforming the culture into a thriving team and a thriving organization. And so if I was to wrap that up, I would say organizations, you need to be able to say what you do about psychosocial well-being of your people. You need to be able to do what you say, and you need to be able to prove it. And when you do that, you're compliant. And when you're compliant, it is a very short leap from compliance to high performance in your teams. Thank you very much.
Thank you, Mark, and thank you, Mark Wright and Jim Kelly, for that outline of where we are now, a place we want to be, and the process to get there using both regulations and all that the implementation of that provides. Getting mental health right at work is good for business and it's good for society. I'd like to open to our audience now to ask questions of the panel, and we'd love for you to say whether use the emoji, the reaction buttons down the bottom, and to say if you've got a question, because we can unmute you, or otherwise pop something in the chat. I think Genevieve's just made a comment, which is possibly for a comment back from you, Jim, that although given stigma and at times discrimination when disclosing, the inclusivity and reduction of stigma needs to be factored in with implementation. Genevieve, that's an incredibly important issue that I know Mark Butler has also spent a lot of time on. Jim, do you have something to say about this issue of stigma?
Yeah, thanks, Genevieve and Liz. I think a few of the speakers have touched on the importance of psychological safety, and I think that's very much assigned to how you manage stigma in your workplace and work environment. If stigma continues to exist, if you can't create a psychologically safe work environment, then people aren't going to put their hand up to disclose a work or non-work related mental ill health issue until it's too late, until they don't have a choice, until they have a breakdown of some sort in the workplace. And that's the worst thing for a workplace or organisation or team leader to deal with, because it's too late to intervene and prevent the harm that's being caused and identifying the hazard first and foremost. So the importance of psychological safety can't be stressed enough. And to create a psychological safe workplace, it's about a supportive workplace culture where people can disclose if they're having a bad day at work or a bad day at home, where the challenges of work-life balance and everything that comes in between can be shared in a safe environment, so that the team leader and the team and organisation around them can support them through those challenges and identify any hazards in the workplace that they can control or influence. And I think if stigma exists, which it does in the community broadly speaking, but if it exists in your workplace context, then you're not going to get people to volunteer that they have challenges, or even volunteer that there are hazards in the workplace that are contributing to their mental health. So it's absolutely critical that we get psychological safety right.
Thanks, Jim. I know my own work.
Can I add something to that, Liz, as well, which is corroborating what Jim says, and I think might be interesting for Genevieve too, is there's about 100 years of research into what the common factors of mental health recovery are. And you know, there's been, as I say, 100 years of studies, but boiled down into 4 areas. And if you could picture a pie chart in front of my face, you could say 40% of the likelihood of someone recovering from a mental health challenge is based on what we call their social capital. So in other words, the community support, the support that they get from colleagues, family members, siblings, etc. And leaders in the workplace can influence the likelihood of somebody recovering as much as 40%, which then develops the sense of hope that somebody has in recovering. So you can see I've now shared that 70% of the likelihood of recovery comes from that level of sharing and being fit. It's okay to not be okay kind of environment. But stigma is a gut instinct response to our environment. So it's deeply enmeshed in our sort of evolution, if you like. So it involves us sharing and speaking out that it's okay to not be okay. We can't assume people know that. So any leader that I am ever speaking to, as I say, you have to be explicit about this. You have to share that it's okay, and emulating that by usually sharing some level of vulnerability, etc. So stigma is something that's going to exist, but sorry, and Jim, just one thing, just when we invite everyone in an organization to anonymously share the psychosocial hazards that they're experiencing, it's that level of anonymity gives people the opportunity to be able to get past that, so that we do learn what the challenges are. So I hope that helps, Genevieve, as well.
I just want to expand on that, Mark, if I can, to a question that Julie raised in the chat as well, Liz, around the board members and how do they, obviously when they have frontline experience, that really helps in understanding the hazards and risks in the organisation. But building on what Mark was just saying, in terms of creating that psychological safety, if leaders like the board members and the C-suite executives show some vulnerability and share their life experience with dealing with the challenges, and we know many C-suite and board members experience mental health just like you and I do. It does not discriminate, if not more. When they do, and I've seen this in organisations, the impact that has in terms of creating a psychological safe environment, and when you see your leader show some vulnerability, that creates an environment where people can be more vulnerable and disclose and share any challenges they may be facing. And then the organisation needs to rally behind them to provide the support network they need. But with all good work health and safety, it starts with really strong, visible leadership and really meaningful consultation. I think that's really critical in the process.
Thanks, Jim. In my own work, I did find when teaching mental health at the master's level, one exercise that was really powerful was to reflect on how much we do or hold some stigma towards people who have mental health challenges, and to take that awareness into our world and, you know, learn to teach ourselves, to discipline ourselves for inclusivity, and not to see in any way. It's like a practice that I think is powerfully helpful. I want to throw to Mark Wright for a moment for a question from Mark Story, all these marks. Who's just, Mark, can you see in the chat, Mark's stories brought to our attention the tension between the goal of helping employers ensure they're creating psychological safe workplaces and the goal of screening employees to make them aware of the possible need for support. And we're linking back to the US. You've brought to our attention the tragic statistics that, heightened. Our understanding is heightened with the suicide statistics. The solution is heightened with our understanding that actually early intervention in suicide is really powerfully effective. Just wonder if you've got any comments for Mark's story. Can't hear you, Mark. Right?
I'm not quite sure what Mark means by screening, but it is quite common for organisations to map from start to finish the employee life cycle in terms of doing pre-employment screening and ongoing health monitoring. And look, I do recognise it's a bit of a challenge because you're delving into sometimes personal situations, and organisations aren't always fit clinically to deal with individuals' circumstances that are outside of the workplace. So yeah, I can understand the tension between the two, and I guess not short of mandating some quite in-depth screening of individuals, having psychologically safe workplaces where people feel comfortable talking up's important. But I also think if you do take a risk-based approach, there is nothing wrong with justifying formal screening, particularly of positions that are of high risk. We work with organisations to do psychosocial risk assessments, and part of that is not only at an enterprise level, but to go down a bit deeper to understand job groupings and those high risk positions that might have high levels of exposure, to then justify some of these interventions around either screening or deeper health monitoring. So hopefully that helps, Mark, but yeah, it's a little bit hard to sort of read between the lines when you're answering a question on a message. There's also a really good question here from Leanne around any tips on better engagement with increasing remote workforces. I find that super interesting, particularly now that it's not uncommon for organisations or individuals, at least within organisations, to work remotely, either permanently or part-time. Some of the best solutions I've seen is, I guess, strategically organisations really reinventing their operating model to better understand how employees interact, either remotely or in person, and tailor-made their operations to coincide certain activities being in place on certain days of the week. So for many organisations, they mandate or encourage employees to come in on a Tuesday or a Thursday, for example. And it's around adapting your operating model, adapting the way you collaborate or your team meetings or some of your operational activities to coincide with the Tuesday or the Thursday. But more broadly, looking at things across the year as well. One of the things that we do in our organisation is we have a Fun Friday once a month. Our team work remotely permanently, so it's not short of being on WhatsApp every day, having some sort of human interactions near impossible for us, particularly the widespread nature of our workforce. So we have fun games, trivia games and things on a Friday that are completely non-work related. It's yeah, a great way for our team to get to know each other personally, and a great way to engage on another level.
Yeah, I'd agree, Mark. And I think anyone who's leading teams, I think we have to double down on the interactions that we have with people and don't assume everyone as well. Reaching out just for the sake of reaching out, there's nothing wrong with doing that. It doesn't have to be a work-related call every single time. But in order to deepen engagement, if people feel like they belong and they feel like they matter to a team, much of that work actually resolves itself. But so it's so much more than just ticking boxes. And as Mark said, introducing something that's new and novel and different. I think we have to. the more isolated people are feeling. As I just shared, the #1 use of generative AI is for therapy and companionship. I think that's kind of sad, I think.
Yeah, I love that, Mark, Wright, as well, in terms of bringing fun into the workplace. When we talk about really advanced mental health strategies, it's really around work design and designing work to eliminate psychosocial hazards as much as possible, or to manage and the risk as far as practical. And we've heard, I think someone in the chat referenced the work design job resources model by Dimitro, I think it was. Some of his work now is really looking at playful work design and how do you introduce playful activities into your work design elements. And the example you just provided is a classic example of how do we have some fun and engagement on a Friday in your virtual team to make fun in the workplace, to make it enjoyable, but also encouraging engagement and build those relationships, which have all sorts of benefits for organisations as well. So playful work design is a really exciting space that the literature is really building strong evidence behind, and something I find very interesting and very passionate about.
Totally, Jim. Yeah. And actual fact, when we look at burnout increasing in somebody's situation, the first thing that they lose or they push away is any sense of fun or play or engagement with other people. They double down on the work because they feel like they need to be doing more. They're not getting enough done. They're judging themselves. They're becoming very self-critical. So any sense of fun or play is the first thing to be sacrificed in that situation. Paradoxically, it's the one thing that's needed to, to fight back against burnout. So unfortunately, that's where it's at. So
thank you, Mark, and thank you, everyone. I want to recognise that we're at time, but also the panelists are happy to stay on to answer questions. As a closing note from the World Federation, this year our theme has been it's time to prioritise mental health in the workplace. And this conversation that's just occurred is a really optimistic, hopeful conversation in my mind, because what people need to be mentally well is a sense of connection, a sense of meaning in their life, a sense of mastery. And the workplace is unique in being able to provide those things to us. So this is incredibly important work, and we're really grateful to have you in this conversation. The World Federation for Mental Health has a number of sectors, and if you go to the website, you'll see this particular meeting sponsored by the workplace sector and the global program sector. We're also lucky to be joined today by Julie Millard, who heads up the women's sector. There's a number of other areas that we're investigating continuously, working with both the UN and the World Health Organization. We're here to support you all to increase your attention to these issues of mental health in the world, to raise our awareness of the impact of them, and then to hopefully with that awareness to activate our capacity to accept it. That acceptance leads naturally to motivation. And as we've discussed in the stigma part of this conversation, one of the key ways to cut through and make a massive change in our world is to encourage inclusivity, to stop seeing people who are challenged with mental illness at this time as other, to help address the fear that is a natural human response to people who may not be so well, to see the effect it has on our community. We'd love to stay for any more questions, and thank you so much for coming. That's the official end, though. Thank you, Julie, for popping in the. I mean, please feel free to unmute or to put an emoji up if you don't want to put something in the chat. Thank you all for coming. Hello, Julie. Lovely to see you. Mario, can you unmute?
Yes,
Julie?
I'm unmuted now. Hello, and thank you everyone for a fantastic discussion. Workplace mental health is vitally important, and the more we can do about it, the better. And raising awareness, and this webinar is just one way of doing it. But I would like to thank all the presenters, Liz for organising, and for the workplace mental health section, and as you as the chair. But also to recognise the valuable contributions of the speakers, but also to the attendees. Some fantastic questions there today. So thank you, everyone, and please look forward to World Mental Health Day when it comes out in 2025, whatever that theme will be. Thank you.
Thank you, Julie. And I will finally also thank Mark Wright, Jim Kelly, and Mark Butler. It's been really lovely to share this conversation with you. Any questions for those of you who are still around? Or thoughts? We don't need questions. Thoughts. Inspirations. I would love to hear what people are going to do. If there's anything that has come to mind. I really like Fun Fridays as an idea for engagement in remote teams, Mark. I think there's a lot to be said for remote teams, particularly for people who are challenged with mental health issues.
Liz, I shared a link to a journal article that Arnold Backer and his team put together around that playful work design and the benefits for employee engagement. It's well worth a read, and I encourage all workplaces to consider how they can integrate it into their workplace.
Thank you, Jim.
Actually, and just a little anecdote to share as well, Liz. There's an organisation I work with that's at the cold face when it comes to looking after those without a voice in our community, and so their work can be very, very challenging and traumatic. They have introduced, it's a little bit like a Chris Kringle kind of an idea, where you choose somebody in the team once a fortnight to do something nice for them, to let them know that they're sort of valued and acknowledged. And the trick is you can't let them know who's doing it. So, sometimes it's an anonymous thank you note or a muffin on their desk or whatever it is, something small, just a way of thanking them for doing the work that they do. And when it's anonymous, it just lifts everybody, because everyone shares in the accolade and the joy of it, if you like. So there are very, very simple but hugely effective ways of letting people know that they belong and that they're valued and that their contribution matters. And I think it goes such a long way to developing, as Mark said, trust in leaders and psychological safety. And as Jim said, who benefits from all of this? It's all of us.
I would like, for the sake of the recording, I would love comments from Jim and Mark Wright about metrics that predict performance as well as mental well-being. Specific, like major metric, magic metric.
Yeah, look, there's often that sort of bullet. But I would say if you can find a diagnostic tool that is statistically reliable, it's easy to administer, and use it over time, you start to see trends, and then you can start to form predictions on what the future might look like. I think the key there is to try and find some sort of tool, either a diagnostic tool or as other forms of technology come to light in the workplace, that is statistically reliable, that you can use a trusted benchmark for to be able to predict the future.
Thanks, Mark. I love that. I'd love any thoughts on qualitative assessments. Does anybody have time or can make the ROI argument for having qualitative assessments on the impact of development programs for psychological safety? Jim, I'd love your thought on that. I mean, how do we capture in a metric the fact that your leader listens with a genuine heart, and that leads to me wanting to come to work? How do we do that?
It's a real challenge, isn't it, Liz? I obviously talk about lead and lag indicators, and traditionally we've been doing a lot in the lag indicator space for work health and safety. We measure claim numbers and incidents that occur. We still focus a lot on near misses. We are starting to get more and more in the hazard space and the hazard identification space, but even that traditionally has been seen as a bad thing. And I think in the psychological space, it should be seen as a good thing. I get very nervous when I see a reporting of psychosocial hazards. I get less nervous when I see a high reporting of psychosocial hazards. And I think that shows psychological safety. It shows that people are happy to raise concerns, and you can't fix a problem if you don't know where the problem is. So for me, really focusing on those lead indicators that allow you to identify issues before they become a problem, and to intervene early. And the best way to do that is through meaningful consultation and engagement with your staff. So I think, getting back to your question, what's the best qualitative way to do that? I think there's a range of employee engagement surveys and employee engagement focus groups and ways to engage employees and measure that engagement. I think that's probably your best predictor for that psychological safety piece, is if your staff are well engaged and happy to be honest and open about what's going on in their workplace. That enables you as an employer to take action on the issues before they become a problem. And I think that's absolutely critical these days.
Thanks, Ginger. It reminds me of my work, my research on elite sailing crews. So I've been studying elite sailing crews in the Sydney to Hobart, and one of the papers that we wrote was about, high performance, team resilience, yeah. And this idea came out of it of tensility, and that was that it links to Mark Butler's presentation because performance is the other side of this psychological safety. And what was really clear was when people had the ability to be emotionally in any state, So the team performed well when there was the ability to hold both negative and positive states. It was so clear. Links very much to what you've just said about wellness in the workplace. Thank you. Any final thoughts? We're getting close to, 1:15. Any final thoughts from anybody or questions from the audience?
I think I'd just really reiterate what I said earlier. Any good, effective organisation that manages health and safety has really positive, strong, engaged leadership team. So business need to start there and get the board and the C-suite executives leading by example, being open, being honest, and being vulnerable, and then having meaningful conversations through effective consultation with their workforce. If you get those two elements right, then the staff, the team will tell you where the issues are and give you the opportunity to drive change.
I've just popped a link in the chat to our paper that just has some really beautiful words about connectivity and strength and tensility in relationships.
Love to look at that.
I will, I think I'll call our meeting to an end because I can't see any more questions from our audience. Thank you all. Thank you.
Liz.
On behalf of the World Federation and our community and society. Thank you.